Welcome back. In this video lesson, we're going to discuss colic. Now, colic is the general term to describe abdominal pain in our horses, and it's due to various causes. Now, you should note that colic is the leading cause of death for horses under the age of 20. It can be expensive to treat, could require surgery to save the horse's life, and we do know that there are dietary factors that can influence your horse's risk of having colic. Now, impaction colic is the leading type of colic seen across the world in our horses. And this is basically a bowel obstruction caused either by the digesta or what the horse has eaten or foreign materials. So when we look at the digesta in an impaction colic, it tends to be dry or firm masses of forage or feed that get stuck and then get impacted. Or you see things like sand for any horses that are eating around or on sandy soils, parasites. So, again, that underlines the importance of a good parasite or deworming program with your veterinarian, or things like enteroliths, which are minerals in the gut of the horse. Now, impaction can be incredibly painful for the horse because as that feed or material gets stuck, you get this buildup of gas and fluid behind it. Prolonged impaction colics can lead to a rupture of the gut wall, which is incredibly dangerous for the horse's health. Now, there's two sites of narrowing in the large colon where we see a lot of impaction colics. So this is where you're going to probably typically see most of our colics at the transverse colon or the pelvic flexure. And then these retropulsive contractions slow the movement of digesta in these areas. Now, it's very important if you suspect your horse is suffering colic to call your veterinarian immediately. This is one of their common cases that they see, and they can best advise you on how to handle your colic. But signs of colic can be mild. Sometimes a horse could be suffering a bout of colic and they hide it very well. They hide pain very well. Or it can be very obvious that a horse is in distress and a lot of pain. So you want to call your veterinarian even in those mild cases. So some of the signs you may see: pacing, stretching, rolling. That horse has pain, so they'll be nipping at their sides. You'll see tufts of hair on the sides of their abdomen. Uh, you know, just doesn't look well, is not happy, is not eating, pawing at the ground, straining to defecate. All are signs of impaction colic. You can also look at the fecal balls if they are passing manure, and they could either be small, hard, or you might even see some mucus because, again, that slow transit will develop mucus around it. Then you're going to see things like the heart rate, sweating, pale gums, all of those things as you do your assessment of your horse, that something is not quite right. Now, the good news is up to 90% of the cases do not require surgery, and 40% of the cases do require multiple visits from your veterinarian or could possibly require hospitalization. But 90% of the horses do fully recover, and then 58% of horses that do require surgery go on to recover. Now, 50 to 60% of cases do occur after a recent change in management. So, again, when we do all the research studies and we look at all the factors of colic, that is a leading cause. So, let's look at some of the things that could put your horses at risk. So again, it's reducing that intestinal motility and that dry digesta. So poor dentation. So the horse is having difficulty chewing their feed, feeding coarse roughage, low water intake. Again, that dehydration or that hydration that's so critical to keep everything moving in the digestive tract. Horses that have reduced turnout or stall rest. Any changes to their exercise program or stress. Now, what's interesting is you do see more impaction colics occurring in the winter, and these are some of the factors. So, looking at that more closely, so changes in forage, if you can imagine your horses were out on pasture And then those pastures become less productive late fall, going into winter, or if you're in an area where it snows, and so you're feeding them hay. So switching to a new hay or that abrupt change can put your horse at risk of colic. Then changes in drinking behavior. It's cold, so horses won't want to consume cold water, so they'll drink less. And then also think you're not probably riding as much, you're not competing or training as much. Your horse is probably getting less exercise during the winter. They're standing around their stalls or run-in sheds. So we know exercise and movement helps the digestive system move the feed through it. So that rest can be a contributing factor. So one of the things you want to look at when you do get your hay analyzed are NDF values less than 65%, ADF values less than 45%. And if you are transitioning a horse from pasture to hay, you want to do this slowly. Now, some things you can also do too is you can soak forage cubes, pellets, or beet pulp, which will help hydration and also ensure that your horses are getting their regular dental exams. Also, you want to watch your horse's drinking behavior during the winter. You could use heaters or heated water buckets, and then feed that salt, 2 tablespoons of salt, and provide loose, free choice salt. That will help encourage the horse to drink. Then also you want to ensure your horse is moving around. So try to provide daily exercise and turnout. Encourage movement so you can place the feed around or different water stations that will encourage your horses to move. Then always, always, always make those diet changes slowly. So here's an easy diet transition schedule over 16 days. So day 1 to day 5, you feed 75% of what you were currently feeding them. Introduce the new diet at 25%. Then you do a 50-50 over the next 5 days. And then in those final 5 days, it's 25% of the current diet, their old diet, and then 75% of that new diet. By day 16, you can feed 100% of that new diet, and that horse should be transitioned. So overall, colic is a serious ailment that many horses can experience, and we know a lot of it goes back to diet and our management. So hopefully these tips will help you in how you manage your horses.